And so my two rules when it comes to getting back to activity are, the first is while you're doing the activity, the symptoms should not exceed like a 3 or 4 out of 10 while you're doing the activity. So if you're having shoulder pain and you want to lift weights, you want to go to the gym and bench press or do an overhead press, while you're doing the activity, the pain should never exceed that 3 or 4 out of 10 while you're doing the activity. In fact, even if there is a little bit of pain, that actually can be therapeutic for the symptoms, but it shouldn't exceed that. It shouldn't pass that threshold into an aggravating stimulus, which is that 3 or 4 out of 10. And then the second guideline or the second rule is you should be able to do that same level.
Welcome back, friends, to the Erie Wellness Podcast, where we explore a wide range of wellness topics, highlight the incredible local resources right here in our community, and encourage you to advocate for your own health and well-being. And as I was getting ready for today's podcast episode, I was really reflecting about why I started this podcast in the first place. And it's kind of funny. We had lived in Erie for about 10 years, and I still feel like I didn't know about all of the resources that we had here in our community. So that's really where this podcast came from, creating a space to learn, connect, and just make it easier for all of us to find and trust local professionals. So when MoveLab popped in downtown Erie, I had the same thought, like many of you listeners are thinking, like, what is this practice? What are they about? So today I'm excited to sit down with Dr. Michael Van Portfliet from MoveLab, a new physical therapy and sports performance clinic here in Erie, and learn alongside all of you what they're all about. Welcome, Dr. Michael Van Portfliet.
Thanks, Lauren. I appreciate it. Thanks for having me.
Why don't you start off with your story? What led you into physical therapy and what inspired you to create MoveLab here in Erie?
Yeah, so I grew up playing a bunch of team sports. I played football and baseball and ran track and basketball as a kid, and I had the opportunity to play Division I football in college. And it was a great opportunity for me. Luckily, I didn't have any catastrophic injuries, but if you play any sports, you probably know you spend a lot of time in the athletic training room. Just for little niggles here and there, or just more preventative basis. So I got to spend a lot of great time in the athletic training room, and I just saw that atmosphere, and I saw the athletic trainers and the collaborative approach that they had with the athletes. And I thought that was just a really cool thing that, if you're an athlete, you're coming in and you're limited in some way. And so the athletic trainers put their heads together and they try to kind of put their detective hat on and figure out what it is that's going on and how can we best help serve you to get back onto the field. And I just thought that was such a unique role and a great opportunity to help people. And so through that, I got involved with a local physical therapy clinic up in where I went to school. Had a great experience there, and then just decided to go full bore into physical therapy. And so from there, I had the opportunity to go to Regis University in North Denver to get my doctorate and practice down in South Denver for a few years. And that's where I got my board certification for orthopedics. And then after that, I had the opportunity to practice up in Boulder with a world-renowned clinic with world-renowned physical therapists for the last 8 years. And then now just being closer to my house, closer to my family. Our life is in Erie, except for our house. We live in Firestone. So Erie was a great fit. Erie is a great community. There's no doubt about it. It's a growing community, and it's full of a bunch of people who are interested in taking care of themselves, staying healthy. So this was the best fit for me.
Awesome. Well, welcome to Erie. We're excited to have you here. Sounds like the athletic training room really kind of became home to you being an athlete. So it's really cool that you were able to make a career out of it and help other athletes as well, long term. So
yeah. Yeah.
So you work with a wide range of people, from student athletes to parents to retirees who just want to keep active and do things that they love, like skiing and hiking. So what are you seeing most right now in our community when it comes to injuries or movement challenges?
Yeah, you're right. I think what's great about my role is that there's a lot of variability. Like everyone's different. Even a 50-year-old woman with the same orthopedic diagnosis can present entirely different. And so that makes my job really fun because it's just so different. Every single patient's so different. You get to interact with all sorts of different people, which is awesome. As far as what I typically see and what I'm seeing in this community, again, is kind of wide ranging as well. I have my board certification in orthopedics, so I treat head to toe, shoulders, low back, neck, anywhere between headaches, dizziness, ankle sprains, strains, bruises, anything along those lines. And what I typically see here is I see a lot of spine related disorders, and that's just by nature. The majority of people with orthopedic issues is spine related disorders. So low back
Mhm.
pain, neck pain. 2/3 of America has low back pain, and a lot of that percentage has chronic low back pain. So there's quite a few people who have those considerations, and that's probably the majority that I see. But
Mhm.
I see a lot of like orthopedic stuff, so shoulders, knees, hips, ankles, and that's usually related to overuse injuries, where everyone wants to continue to be active and have fun outside or participate in their sport of choice or CrossFit, weightlifting, something along those lines. And when we overexert those tissues, then there could be some injury along that side. So I see a little bit of that. And I have also quite a few postoperative patients. So a couple postoperative ACL repairs, a couple total knee surgeries, a rotator cuff repair. So kind of a splattering of everything here.
Yeah. You brought up like lower back pain and how that's like extremely common. Is that just because of the lifestyle that we live, or what's kind of bringing that up?
Yeah, that's a good question. It's very multifactorial. Pain is multifactorial. So, and I'll tell patients this all the time. It's not necessarily entirely all physical. There could be some mental, emotional, um, life things as well when it comes to pain.
Mhm.
I handle a small sliver of the pie, but there's all sorts of different ways you can address pain in general. But yeah, I think the spine is just it's the keystone of your body, right? So it's the area where most forces converge. Um, we can make an argument about activity and our lifestyle, sitting at desks and not being as active, that type of thing.
Mhm.
We can make an argument on over medicalization of back pain where we get images for everything, that type of stuff. But it's hard to say why, but that's just the case now. So
Right. No, I was just thinking, I was like, as you get adults, you just get busy. So some people just aren't able to like stay active throughout their day. And oftentimes you'll be at a desk like all day long. And then you're in a kickball league. So like once a week you exert yourself, or like on the weekend you work out, and that's when you exert yourself. And then something pops up. So
yeah, there's no doubt that could be contributing it. Not just low back pain, but any orthopedic issue too. It's the uncle who runs a 5K every turkey trot every Thanksgiving who comes in and says he has knee pain. That type of
yeah.
thing. So yeah.
Mhm. You help with people who are recovering from injuries, or also you said post-op. So what does strong, effective support look like, when and where do people sometimes fall short, in your opinion?
Yeah, I think strong support is all through communication. That 100%. That's what it is. It's communication. And so that's why I've always given all my patients my cell phone number. Never once has one patient abused that. it is that communication. So for me, as the healthcare provider, that strong support is it's my responsibility to be a leader in that communication. So always reaching out to the patient and asking them if they have any questions, or being kind of on the forefront of reaching out to them after a session and making sure if everything is feeling good. And so I think that's the biggest thing is the communication piece. Where people fall short is probably where that communication falls short. Oftentimes, especially coming from a physical therapy background, therapists and healthcare providers get really busy. And so when they're busy, it's harder for them to make that mental note. I got to reach out to Sally. I saw her last week. She was having a hard time with her knee. I just want to check in to see how she's doing. And so I think that's where a lot of folks fall short, is that communication side of things. So yeah, for me, that's the most important thing. Like email, text, phone calls. I'll always get back to people within 24 hours, if not sooner, or more than anything, just being on the leadership role of reaching out to them even before they think that they need to reach out to me. I'm always there to reach out to them, to check in on them. So,
and just kind of setting expectations. I'm curious, is it most of the time you're setting up like a plan for them, or is it sometimes just as simple as like they come in once or twice and then they're done? What does that look like?
Yeah, that's a great question. I would say almost 100% of the time, patients, when they come in for their first visit, they're not looking for treatment. They're not looking for care, during that first visit. We typically still do that because we have the time to be able to do that. And, maybe I guess I would say there are certain times where there's an athlete who wants to race this weekend and they need to come in. They need some sort of modality to help them feel better so they can do the race. Of course, we'll spend most of our time with treatment, but most patients that come in and what they want to leave with is a plan. That's the majority of our first visit usually is being able to take them through a thorough evaluation process, get a firm working diagnosis. And what that working diagnosis does is it gives us a prognosis. And so that prognosis is really helpful to set those expectations, right? So you came in, you're having knee pain, your goal is to be able to run a marathon, right? So from visit one, what does that look like to take us to that marathon? Or better yet, how do we go from that marathon and reverse engineer to where we're at right now? And then what are those mile markers that we need to hit on our journey to get there? And so that's a lot of what we discuss about. It's like, if you're having knee pain, the prognosis of knee pain is 4 to 6 weeks, you're going to be feeling better. But in reality, like, you got to also build up your mileage as you're running your marathon, right? And so what does it look like for you to feel good and healthy and be able to run those long runs on Sundays to get you ready for that marathon? And so, yeah, that's probably the majority of what we typically talk about and communicate about throughout that whole process. What does that look like? And so I'm there seeing them during that journey. More often than not, I like to see people sooner on the first few visits just to make sure we're on the right track. But as we go on, we definitely spread out our visits quite a bit as we start giving them the things that they could be doing on their own.
Okay, that makes sense. And yeah, communication sounds like it would definitely need to be the foundation so that both people are on the same page of like what needs to be happening,
Yeah, definitely.
One thing that stands out about MoveLab is the focus on getting to the root cause, not just treating symptoms. So what does it look like in practice, and why does it matter for the long-term results?
Yeah. So I'll always tell patients, like, I never want to see you again for this same issue. Like, and again, and this is something that's common, right? So if you were to come in, we'll use the example of knee pain for marathon, right? We're able to get you feeling a lot better. And that's probably the easiest part of our job, is to take the symptoms away. So that's not hard for physical therapists or chiropractors or massage therapists. Like, any allied health professional, that's the easy part of the job. It's
Mm-hmm.
taking those symptoms away, right? And so oftentimes that's where the root of the issue comes in. We call it regional interdependence, meaning that yes, you have knee pain and we can calm your knee pain down, but why is there knee pain going on there in the first place? Well, you're
Mm-hmm.
running, right? So you're running with both legs. Why is there knee pain on one leg? All right. So now we have to look at what's going on with the ankle, what's going on with the hip, what's going on with the adjacent joints that might be contributing to that knee pain.
Right.
And, my goal is your goal, right? So you came in here to tell me that you want to run a marathon in 3 months. I want to help you achieve that goal without having any setbacks. So that means we address your knee pain right now. But once your knee pain has calmed down, and as you're building up your mileage, what does your ankle look like? What does your hip look like? What does your feet look like? What does your low back look like? And that's
Mm-hmm.
what's going to help you stay feeling good while you're building up that mileage.
And it's probably understanding how do you stand? Like how much pressure do you put on this part of your foot when you're, like all of these things contribute to it. So understanding how you move is so important.
Yeah. Physical therapists, I'm biased, of course, but there's not a better profession. There's not a better professional who can look at your body and the way you move and be able to prescribe the right dosage, the right medicine for that. And so that's how we're trained, is we're movement specialists. And so if we can take a look at how you squat, or how you balance on one leg, or how you load certain muscles, how you do a deadlift, like those type of things, that gives us good information for the demands of the sport that you want to get back to.
Mm-hmm. Absolutely. So if you could give one piece of advice to the general population to help them move better and stay active longer, what would it be?
Yeah, that's a great question. I love that question. I would say if you're to take a magic pill to improve longevity, to improve your heart health, to improve your lung health, to improve your muscular health, to improve your bone health, to decrease risk of you having injury in the future, it's resistance training, strength training. That's my number one thing. Yeah, it holds up in the literature, in all studies, strength training and progressive loading. So progressive strength training, not just like staying at a certain weight, but continue to build weights as you go on. That is the number one thing that, as far as moving better, feeling better, that is the best thing I think you could be doing to help maintain the lifestyle that you want to live as you stay active.
Okay, so if we have a listener who's like, I've heard this a lot of times now, and I should probably take this seriously. What is the sweet spot? How many times a week do you have to strength train to be able to help with that longevity piece?
Yeah, that's a great question. The answer is, it's like, this is the classic physical therapist answer. It depends. It depends. Yeah. Right. So
every person's different.
Yeah, everyone's different.
We're on a lifelong journey figuring out what works for us and what.
Yeah. And what it looks like for me may look like different to what it looks like for you, to what it looks like for my mom or my kids, So I think is the main thing is just getting started, and just once, I would say even just once a week. Once a week, what does that look like? You pick up some weights, preferably you have someone watch you while you do it, just to make sure you're doing it as efficiently as you can. And then seeing where that takes you. For untrained individuals, it's proven in literature to show that even once a week could be enough for you at a moderate intensity. For people who are more active and have a lot of experience in weight training, it might take them twice a week or 3 times a week at a higher intensity for them to have the gains that they want to have. So the answer is, it kind of depends.
Okay.
Yeah.
As you were talking, I was thinking, in terms of strength training, then do you start with core and then work your way out to prevent injury, or even just getting a stronger core? Does that help anything more, or just try and do a full body workout as best you can?
Yeah, I mean, compound movements, what you're describing as like full body,
Mm-hmm.
those are great because what they do is they get your core by like proxy, like by default, your core is working by default.
Mm-hmm.
Um, my preference is yes, definitely working on big multi-joint movements. So what you think of like as a squat or a deadlift or overhead press or horizontal row, something like that get multiple joints. You definitely get more bang for your buck with those type of movements than you would with
Mm-hmm.
like an isolation movement, like a single joint exercise. If you're looking for just core robustness and like overall like utilization of bigger muscle groups, that's my preference. That's why we have a lot of free weights in our gym. We have a rack, we have dumbbells, kettlebells, hex bars, all the above in our gym.
Mm-hmm.
But there is a place for also isolation movements as well. So like machines at 24-hour fitness or Vasa or
Mm-hmm.
1440, wherever you want to go, there's a place for that as well.
I'd love for you to share. So what does your practice look like on the inside? Because I was in there yesterday and yeah, you have weights, you have a whole gym basically for people to work on their strength training as well. So do you want to describe your location and where you're at and what it looks like?
Sure. Yeah. So I'm on north side of Briggs Street. If you know Briggs Street, you know the Allo building. We're on the second floor of the Allo building. And it's a great building. It's a great space. We have nice high ceilings and great windows and natural lighting and stuff. But yeah, the majority of my clinic is the gym space. There's an entryway and then there's the gym space. And I would like mimicking kind of what you would think of like as a CrossFit gym in terms of the equipment that I have. So a rack with weights and barbells and heavy kettlebells and GHD machine, those type of equipment, because so much of what I do to help get people back to those activities that they want to do is getting them on those machines or loading up the barbell on their back to heavy weights and seeing what their body does to accept those levels of intensity and what
Mm-hmm.
those tissues do under those loads. And so it gives me I guess it's my lab, right? It's a MoveLab. It's my lab to test certain types of things when I'm loading those individuals and kind of testing them to see what they do when they eventually want to get back to those activities that they want to do. So
Mm-hmm.
yeah, it's a nice gym space. And then I have two private treatment rooms for therapists here. I think the private space within the room is just nice to enable to give the patient a good space to tell their story.
So this year on the podcast, we're collecting listener questions. For this particular podcast episode, we've collected two. And the first one that we have today is, I see that it's named a physical therapy practice, but they do not accept health insurance. So Dr. Michael, can you share why you guys have chosen to be an out-of-network practice?
Yeah, I totally understand that question. I worked in a physical therapy clinic that was in network that accepted insurance for a long time. And the reason why I've elected it's called out of network, which means that we still supply you with a super bill that you can submit to your insurance, is over the last 30 years, we know that the price of living has just gone up, inflation has just gone up. Insurance reimbursement for physical therapy has only gone down over the last 30 years. It has never gone up. And so, unfortunately, what that does is it requires physical therapy clinics who accept insurance to make up that change in revenue by adding volume. And I was just like that when I just graduated from PT school. I was seeing patients, 20, 30 patients a day, 15-minute visits, 20-minute visits, and I was handing them off the techs to run them through exercises. And again, it's not a bad thing. It just wasn't what helped me grow as a physical therapist. I'd go home every night, dog tired, and I was wondering if I ever really helped anyone that day.
Mm-hmm.
And so the reason why, again, we went into out of network is it gives me a little bit more time to spend with patients. And overall, what I find is that in the long run, in some cases, I actually save patients money because I'm able to, in the time that you're being able to be seen in network, which is 2 times, 3 times a week for 6 to 8 weeks. Most people have high deductibles now, so you're still paying a high copay during those visits. I'm able to see you once a week for 4 to 6 weeks, and I'm able to get you there quicker. And so, and it's nothing special to what I do. It's just the model of spending more time with patients, hearing them out, and again, setting expectations, developing a plan, and helping them through that plan. And so that's the reason why we've gone out of network. And I think patients really enjoy this model because they get better faster. And I sure enjoy it too, just because my job satisfaction is through the roof because I get to see people get better quicker.
Right. You get to see them when they walk in the door until they exit. You're with them that whole time, which is great. Well, thanks for being honest and just sharing a little bit more about that. And I'm seeing that a lot with some of the other local wellness professionals that we've had is, I was just tired and, it was basically like people were a number and we were needing to get through them quickly. And I wanted to be able to give my patients that more like intimate care and really sit and listen to them and understand what's going on instead of just basically trying to get them in and out the door.
Yeah.
So the second question that we have is it okay to keep working out through shoulder pain or am I making it worse? So can you enlighten that listener on what's going on maybe?
Yeah, that's a great question. And that's honestly a lot of what I'm educating my patients on every day of like, what can you do? What can't you do? What's good to do? What's not good to do? And usually I explain it kind of like guardrails almost, or like bumper lanes in the bowling alley. So if you can kind of abide by these 2 guidelines, typically that means that you're doing the right stuff for your body. And shoulder pain is a classic example because it's so persistent and a lot of things can aggravate it. Even random stuff can aggravate it. And so my 2 rules when it comes to getting back to activity are, the first is while you're doing the activity, the symptoms should not exceed like a 3 or 4 out of 10 while you're doing the activity. So if you're having shoulder pain and you want to lift weights, you want to go to the gym and bench press or do overhead press, while you're doing the activity, the pain should never exceed that 3 or 4 out of 10 while you're doing the activity. In fact, even if there is a little bit of pain, that actually can be therapeutic for the symptoms, but it shouldn't exceed that. It shouldn't pass that threshold into an aggravating stimulus, which is that 3 or 4 out of 10. And then the second guideline or the second rule is you should be able to do that same level or same intensity of exercise 24 hours later. Now, are you going to do that same level or intensity of exercise? Are you going to do 2 days of bench press or 2 days over press? Probably not. But if you needed to, you could be able to do that. So those are your 2 rules. So if you stay within that 3 or 4 out of 10 level of discomfort while you're doing the activity, and 24 hours later, if you're not so sore that you couldn't do that exercise again, then you're in the clear.
Okay. I like having those parameters. That helps. 3 out of 4 pain. And if you could do it the next day, 24 hours later.
Yeah, exactly. Yeah. And that's usually the case. So like we would say that there's we call it a stoplight. It's a green, yellow, red, right? So green meaning you feel good while you're doing the activity, you feel good 24 hours later. That's a green. That tells us you can actually increase intensity in activity. Yellow is, I'm a little sore during, I'm a little sore the next day. Okay, maybe we should stay at the same level of activity. And then red obviously is like, I'm getting like 6, 7 out of 10 pain while I'm doing activity and definitely could not do it the next day. That's a red. That means take a step back in terms of your level of intensity.
Okay. So why is a little bit of like pain okay and kind of good for you?
Yeah, because pain is one of those objective markers that is not the best objective marker because it's multifactorial. And so
Mm-hmm.
a little bit of discomfort, especially when symptoms are more chronic, and that's usually the case where low back pain is classic. Chronic low back pain, most people with chronic low back pain will never have a day that is less than 3 out of 10 pain. That's like their life. That's their new normal. So to tell them that they can't do anything,
Mm-hmm.
it's just not realistic. And so even if they do activity and that 3 turns into maybe a 4, but it doesn't exceed that, that is often a really therapeutic thing because it helps desensitize that tissue, and also it helps desensitize the central nervous system as well. When you have chronic pain, central nervous system gets hypersensitized to the amount of pain that you have.
Mm-hmm.
And so if you can still do activity and maybe it bumps it up a little bit, but that is a really therapeutic thing for both the local tissue and your central nervous system to help
Mm-hmm.
maybe desensitize it quite a bit. So yeah, I'm not afraid of pain. Pain is not a bad thing. Pain's a good
Mm-hmm.
thing, right? Pain should be there. It's a good signal to have, but if it crosses a threshold, then it becomes maybe not the best thing.
Right. When you start to feel tingling, then it's bad.
Yeah.
Okay.
Mhm.
Before we wrap up, can you give us a quick overview of the different ways you work with people at MoveLab and what you offer?
Yeah, classic physical therapist. So, like I said before, I'm an out of network physical therapist, and how I work with people is I typically see them anywhere between 4 to 6, in some cases maybe 8 visits on a more maintenance basis,
Mm-hmm.
one-on-one for an hour when we see each other. And that's kind of like the classic physical therapy treatment that I do. I do offer personal training too.
Okay.
And that's more on a short-term basis for individuals, because more often than not, especially for like post-operative rehab, people who are recovering from ACL surgery, they know they want to get back to the gym, but they don't quite know how to do it.
Mm-hmm.
They know they want to get back to CrossFit. They want to get back to running or any other activity that they want to do, but they just don't know the intermediary steps to get there.
Mm-hmm.
That's where we offer the personal training option to help guide them into those activities that they could be doing on their own. So we would supply them a program that they could be doing within the gym with us, and we can kind of progress and watch them progress with that. And
Mm-hmm.
then they could also be doing Ad Vasa or 1440, something along those lines. And so that's what we offer as well. So that's kind of the 2 main core offerings that we provide.
In terms of the treatment rooms that you have, do you do anything like acupuncture, anything like that? Or is that just to like sit down and like talk to the patients?
Yeah, so we do dry needling. We do manual therapy. I have certifications in spinal manipulation. So what you think a chiropractic adjustment, physical therapists can do that as well.
Mm-hmm.
I have certification in vestibular rehab too. So for dizziness, I see folks for that as well. I hang my hat on what's called PNF. So it's called proprioceptive neuromuscular facilitation. And it's kind of a bridge from what we do on the table in terms of like the passive modalities. So the manual therapy, the hands-on mobilization, the massage that we do, into what we do at the gym. So what we do on the table is we do a lot of manual resistance. So instead of us going straight to the gym to doing exercises, I guide you in terms of how you should move with my hands.
Mm-hmm.
My favorite thing to do is to help someone feel better on the table and then make them sweat on the table by giving them the manual resistance and then transitioning them out into the gym after that. So as far as services, yes, we do dry needling. We do the soft tissue work. We do Graston. We do spinal manipulation. And we do the vestibular rehab stuff.
And your payment structure is pretty simple. It's just an hourly rate, which they can talk to you about. And then like you said, it can kind of vary just in terms of the number of times that they would need to come see you.
Yeah, exactly. Yeah, we're very transparent. It's an hourly rate. Doesn't matter what we do. It's an hourly rate. So you can see that on our website. Yeah, and then it depends on kind of the case by case, but usually it's anywhere between 4 to 8 visits that we typically see people.
Okay, but people could use their HSA cards or like you said,
FSA, HSA. Yeah, absolutely. And again, that super bill is helpful as well to be able to reimburse back into the insurance if you need it.
And I feel like a lot of people are kind of switching over to these different models because there's just lots of things that people want to be able to participate in that like insurance maybe doesn't accept either. Like functional medicine. I mean, there's just lots of things. So it's important to set up those HSA funds and kind of be able to do your own thing on the side too, to be able to really live the healthy lifestyle that you want to live. So,
yep, that's right.
If someone is listening and thinking, I just want to feel better and move better, what's the best next step to get started with you?
The best way to contact me is, again, my cell phone is on the website, so the website is www.movelabphysicaltherapy.com. Cell phone's on the website, emails on the website. Don't hesitate to reach out. I'm also on Instagram, MoveLab PT. Yeah, you're welcome to DM me on that if you have any questions. But that's the main thing. Just I'm always keen to answer questions and communicate over a phone call or meet. I'm happy to do that as well.
Well, thank you, Dr. Michael, for sharing about the MoveLab here on the Erie Wellness Podcast and just helping those people in our community that need to move better and feel better and take care of themselves physically.
Thank you, Lauren. I appreciate it.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time. Thank you so much for listening to today's episode of the Erie Wellness Podcast. If something from this conversation resonated with you, I hope you'll take it with you into your week or share it with someone in our community who might need it. To subscribe, just head to the main page for the Erie Wellness Podcast, right where you're listening, and tap subscribe. And don't forget, when you start to feel better, you start showing up better in all areas of your life, and you deserve that.